afternoon, everyone. This is Winslow Woodland, Deputy Director for the Developmental Disabilities Administration of the Department on Disability Services. I am sitting in for Director Reese.
Hi, can someone please type in the box if you can hear us?
I want to plug in the other room. Test it.
Hi, anyone hear us on the line?
We can hear you.
Yeah, I can hear you.
Thank you.
Yes, yes.
Okay. Deputy Woodland, you can restart.
You want me to go start over? Hi, this is Winslow Woodland, Deputy Director for the Developmental Disabilities Administration of the Department on Disability Services. I am sitting in for Director Andrew Reese. I'd like to first of all welcome everyone to the call. We've combined our community forum with our provider forum. I'd like to also take this moment to just express our tremendous gratitude for our provider community for supporting the people that we serve, as well as the advocacy community for also sharing and assisting with us during this time, the concerns of the community. I'd like to give a shout out to Project Action, self-advocates who we had a very enlightening telephone call. One of my biggest takeaways from that call was during phase one of the reopening, people will be sitting at sidewalks, and I don't believe the conversation has been had that people who utilize devices such as wheelchairs and other mobility assistant devices, that the sidewalks are a consideration. So we're going to, we've shared that concern. I also would like to give a special recognition for the fact that while we're dealing with the pandemic and the public health emergency, our fair city has had to become one of the focal points for recent events in the news. There have been demonstrations in our city which have affected all of us. And I also, again, want to give shout outs to our advocacy community and our provider community, as well as our staff here at DDA for supporting people and ensuring that they understand what's actually happening around them. We've already had limitations placed on our ability to move about freely, and that's been further increased this last week with curfews needing to be established to maintain public safety. With that, I'm going to give you the update on the numbers regarding people who have tested positive for COVID-19. As of close of business yesterday, we had 195 people who tested positive for the coronavirus. Sadly, we have lost 25 people as a result of the coronavirus. And currently, we have 61 people who are hospitalized and 99 people who tested positive but did not require hospitalization. And the breakdown by setting, currently we have 3 people in host homes who've tested positive. We have 13 people who live in their own homes who've tested positive. We have 79 people who are supported by the service supported living who tested positive. We have 25 people in residential rehabilitation settings who've tested positive. And we have 73 people who live in intermediate care facilities who tested positive, and 2 from nursing homes who have tested positive. And to date, we have 224 counts of positive provider staff. There is one person who is reported from 2 providers, so the unique number of people is 223, and sadly, 6 of those have expired. I'm going to turn it over to Deputy Director Kirk Dobson for some updates. Take it away, Kirk.
Thank you. So I just wanted to raise a couple of issues for our providers. Recently, we completed an internal audit of the implementation of Mayor's Order 063 and the emergency policy that was embedded in Transmittal 2001 across all the residential providers, and we found a number of inconsistencies across the board. I urge providers to reread the Mayor's Order and transmittal that was sent and to take steps to fully implement the provisions of the order in the transmittal. If you have any questions or need assistance, do not hesitate to contact your assigned quality resource specialist, or you can call me or email me directly. My number is 202-590-7618. Again, that's 202-590-7618. My email address is Kirk, K-I-R-K, .Dobson, D-O-B-S-O-N, @dc.gov. I have instructed the quality assurance and performance management teams to begin to incorporate the protocols in the Mayor's Order into the performance tracking, including provider report cards, PCR protocols, and considerations for possible sanctions where appropriate. So I really urge all providers to reread the Mayor's Order and transmittals and start to implement, if you have not already implemented any of those protocols in your settings. Secondly, I just wanted to give an update. I have given the go-ahead to resume PCR remotely, and we're doing it as just on a trial basis to see the feasibility. We're really just trying to ascertain how we can do this in the upcoming months remotely instead of having to do it on site. So the PCR team will be reaching out to providers, to the providers on its review calendar to begin scheduling these reviews remotely. If any provider has any issues with that, or if they think there's something that will prevent them from undergoing a remote PCR, please call or email me directly to discuss. Again, it's 202-590-7618. If any provider has any issues that will prevent them from undergoing any kind of any remote PCRs, please go ahead and call. Again, this is only on a pilot basis, so we're just trying to see if it will be successful. As of right now, we have not fully resumed the PCR process. Thank you, Deputy Woodland.
All right, so did we receive questions?
No, so we did not receive any questions prior to this forum. So if you would text, what's your your number to text, or if you can leave numbers in the chat box so that we can respond to any questions you may have. Someone asked if they could have the number again, please. So if you can restate
Sure.
your number.
So you can text right now, or if you need to reach me, it's 202-590-7618, and we're entering into the chat box as well. So 202-590-7618.
And someone also asked about inconsistencies within the audit of the mayor's order. So I guess more information regarding that.
So we will be reaching out to providers that we've identified as having inconsistencies one-on-one to make sure they're going through it. The inconsistencies are more along the lines of just not posting the required posters and signage, or not properly doing their visitor logs or things of that nature. There is no health and wellness problems that we've identified in this audit. It was just making sure that the specific protocols as outlined in the mayor's order are being followed in entirety. And so we just wanted to make sure that we address all those protocols and all those deficiencies. But we will be reaching out to each and every provider that we've identified.
Okay. You stated DDS is considering sanctions. What deficiencies is DDS considering issuing sanctions for? And this is in regards to DDA.
Right. This is specific to DDA providers,
right.
Residential providers who are currently providing services during the emergency. So we are, sanctions is the last resort, but if we identify a provider that is not making any changes or identifying or conforming to the protocols within the mayor's order, we will get to that level if there is no action being taken. That's just, as I said, a last resort. But as I think some people couldn't hear, but as I will repeat my last statement, we have identified certain inconsistencies in things such as posting the appropriate posters and signage as required by the order, or just, incorrect handling of visitor logs and things like that. There is no health and safety concerns for any of the residents at this time, but we want to make sure that providers are following the mayor's order in its entirety and being specific to what is required. So we will continue to reach out to providers as we identify those issues, and help providers to rectify it. The goal is to help providers as much as possible in getting these things done. It is not to penalize providers, but I just wanted to say that as a caveat that sanctions are possible if providers aren't doing what is asked.
Thanks for the Appendix K amendment to the skilled nursing rates. Is there another amendment due to the companion care rates coming?
We are not updating any, well, we have the hourly rates as a part of the amendment, so the companion is a part of the any hourly service provided to a person supporting them through this is a part of the amendment that we have submitted to the Department of Healthcare Finance, and it's my understanding it's with the State Medicaid Director as we speak.
How many residential placements are under quarantine?
As of yesterday, there were 7. I also saw a question about the breakdown of the deaths of people that we've supported. And so we have had 2 deaths, people living in their natural home, 11 from people supported in intermediate care facilities, 8 people who have been supported in supported living settings, 2 in residential habilitation settings, 1 in a host home, and 1 in a nursing home.
Okay.
I just need to clarify. I just was off a bit with regard to the companion service. We are amending or have submitted an amendment to the companion rate. What we recognize through a inquiry by a provider is that we had a group rate of 1 to 3, and we had a 1-to-1 rate. But if 2 people were supported, they would have to have a group rate, and we recognized that we needed a 1-to-2 rate. So that has also been submitted for the amendment as well as the hourly services.
Is there communication between DVH and DDA services regarding staff who test positive who may work in settings under both agencies?
So when we receive a staff profile or we are notified that staff has tested positive for corona or COVID-19, we share that information with DC Health. DC Health does the coordination on contact tracing between agencies and for that staff person. And so we make sure to keep in constant communication with DC Health, our partner in this fight against COVID, and we definitely, all the health agencies are a part of that fight. So, yeah, we do have a conversation with DC Health who then does that work.
Does the overtime for residential services apply to in-home support?
I would specifically ask that you submit that to me directly because the question, as I read it, is not clear.
So what is your number? Deputy?
202
Mm-hmm.
730 1618.
Okay, so that's 202-730-1618, for Deputy Woodland.
Yes.
Does DDS have a proposed timeline as to when programs might reopen? We no longer have a stay-at-home end date to follow, so it's unclear what to communicate to our persons and staff when asked, when they may return to the day program.
Yeah, so this question seems to be one that we're addressing almost weekly, which lets me know that some people aren't always on the call or have not taken the time to review what we've discussed from the previous call. Just so everyone knows, these forums are posted on our website. So if you happen to miss one, I encourage you to review the forum. With regard to the day programs reopening, as the director stated last week, we have a committee of people working on what that actually looks like. Within that committee, as of this week, an offering of an assessment tool from the people on that committee, the draft of an assessment tool that could be used to determine how we phase in people being able to go out. Now, when we talk about day programs, we are also talking about settings of groups of people. The current phase one does limit the amount of people in groups and also has some stipulations that make opening up a day program. When I see day program, I'm assuming that that is a large-scale program with people, more than 10 people. We also have given guidance on, what we believe in terms of phasing the phases. So the most vulnerable of our population likely throughout the phases may have still very limited contact with their external environments. And so this question is a national question. There are states who have opened up, who have not opened up their day programs. And when I'm speaking of day programs, I'm talking about your larger programs. So I'd welcome a discussion from this person at 202-730-1618, because it sort of is interesting that inquiries to this questioner are focused on sharing with people when they can come back to their program. And the expectation of these forums is that you're able to provide guidance. Well, one of the expectations is that you're able to provide guidance to people that we support. And we've asked and answered this question several times. And I just want to make sure we are all on the same page with what the phases look like for people.
And to add what you shared, Deputy, I wanted to, this is Crystal Thomas. I wanted to add that we do meet weekly, and in that committee we have 5 providers. We have 5 folks from staff from DDS, as well as folks from the community, which includes parents of folks with that are at the day program and self-advocates. And so we're meeting weekly. We have divided the committee into 2 subcommittees, working on an assessment so that we can assess folks individually to see the readiness in transitioning back to the day program, as well as another subcommittee of some of our experts from the day program world to discuss that process and transitioning back into the community. So just wanted to give a little bit more information regarding that. Any other questions? Since you have approved remote health visits, what is DDS approved remote meeting application and secure platforms, taking HIPAA and confidentiality into consideration?
So we have taken the advice and the instructions provided by OCTO, which is our Office of the Chief Technology Officer for the District of Columbia. And so we are using what is approved and secure. There are various applications that we'll use, ranging from Microsoft Teams to Skype to WebEx. And, you know, sometimes if phone call will work, but there are other tools that we will use as well. The appropriate staff person who will be reaching out will advise on what capabilities providers have and go from there.
Are other providers allowed to join the committee to discuss the potential plans? So currently, we have 5 providers on the committee. And we definitely want to keep it at a certain amount so that we're able to really move forward with actionable items.
I would add to that also, I'm in the planning phases currently of restarting the provider leadership meetings, and we're hoping to have one in June, late June. And in that forum, we're going to invite executive leadership from every single provider that DDA currently contracts with to a conversation. There's going to be presentations from different agencies, but part of the meeting will be a conversation around, you know, thoughts around day programs. So look for that invite, and we'll have a bit of a conversation there. But to Crystal's point, I think, you know, keeping the committee relatively small is very helpful in getting ideas across. And then we're also, you know, looking to what's the best practices around the country. So I think there's different opportunities for getting some of the best practices, but also if you could also definitely email any concerns or any advice that you have to myself, Deputy Woodland, or Crystal Thomas.
And to that point, this forum also is for anything you want to share as far as best practices, something that you've read or discovered. You can definitely share that with this forum. So it's us answering questions as well as you know, you providing information as well. Is Dr. Brown assisting with individuals who are hospitalized? If so, how many cases is he involved with, and has DDS informed providers how to request his assistance?
So the first part of the question is yes. The second part, I would like to be called directly so that we can discuss that. I'm not going to provide that publicly. And with regard to has DDS providers been informed, in August of 2019, we developed a protocol. It's posted on our website. I have, again, resubmitted that protocol to the provider community. And the sum of the answer is, when a case is deemed clinically complex, providers, DDA staff, and myself, or any of our health and wellness teams, family members, anyone who believes that the criteria for clinically complex has been met and they need the assistance of our physician consultant, is welcome to request a referral. Those referrals are approved by DDA and then submitted to Dr. Ernest Brown, who is our physician consultant and has been since August of 2019.
As for day programs, if a day program has more than one space, could they have more than the 10-person in the building?
So as I think we're saying, you know, we are in the planning phases for day programs and how they look, you know, in this post-COVID world, current COVID world. So, I mean, those are considerations that will definitely be discussed in various forums. But right now, we don't know. I think we're, you know, just a reminder that we are in phase 1 of the mayor's plan for reopening. So we, as part of this plan, there's still a bit of a essential only kind of perspective. So we're not quite there yet, but we are definitely in the planning stages for this. I see a comment here about the health visits and the remote services. To be clear, when I discussed about remote visits or remote participation, from a quality perspective, we are talking about our quality resource staff and our PCR staff. There are no health visits remotely that I am speaking of. The DDA staff will advise the appropriate people about remote opportunities that, as that happens. But I am not discussing health visits. I am talking about provider quality and provider performance check-ins and reviews.
Somebody does.
Some individuals at home in the residential services do not have access or adequate training on technology for remote support. Sometimes the support staff do not have the knowledge or training either. Is DDS able to provide funding for tablets and training so that services can be continued?
I want to stop with that. Go ahead.
So, I think DDS is definitely working on different avenues that we can figure ways for our providers to provide technologies to the people they support and to provide that support to providers themselves. DDS has been working on its Tech First project for a while and is really kicking that off. And so hopefully soon we'll have a little bit more information on some avenues where we can access technology. I will say we are actively seeking out opportunities for technology and technology training, especially as part of this pandemic response. But right now we are really just trying to work with our partners to figure out what we can do. But we do have a Tech First initiative that is getting ready to be launched, and it has launched. Crystal can say more to that, but we are working on certain things.
Do we know yet who will be leading the PCR team?
So the PCR team continues to be led by Barbara Stakoyak, who works with DDS providing, and the PCR team.
So in regards to the newly admitted individuals in group homes, is the 14-day quarantine requirement met if the individual has been confined at his family home for at least 14 days?
So with regard to this question, if I hear it correctly, if someone is new and they are being supported newly with a provider, the question is the 14-day requirement met? This is not clear to me what the question is asking, so again, I'll take this question individually at 202-730-1618. You can call me after this call. I'll be in my office.
Who are the partners you are working with on the access to technology issue?
We are working with our local agency partners as well as federal partners to see what's available. Federal government partners, I should be.
Are there any other questions?
There's a follow-up to that.
We made changes. How have we made any changes to the internal protocol for accessing technology under the waiver? Was this done under the Appendix K, or will it be? Or is this something that what you are doing or working on now? What is the timeline?
We did not amend the Appendix K for accessing technology. And yes, certainly we'll be working on one. And in terms of timeline, I'd have to get back to you on that.
What are the local agencies you are working with on the technology issue?
Other health and other district agencies within the health cluster, OCTO, OCTO, and other technology partners within the District of Columbia government.
I'd like to give an opportunity for our physician consultant, Dr. Ernest Brown, just to explain a little bit about what he does with regard to referrals for clinically complex people. Dr. Brown, are you there?
Yes, can I be?
Yes, so just if you could give the audience, okay, can you give the audience a general overview of some of the work that you've been doing, particularly since COVID has been affecting our target population?
Yeah. So once I'm receiving a referral, the first part is obviously getting background on the persons that needed the consultation. So first of all, I reach out to those parties who have more information. Either we set up a email or conference call to discuss first. And then getting that background information gives me a sense of how I'm able to intervene. Specifically for COVID-19, look, I'm in the front line for COVID-19 for my patients as well. So it's really been evaluating first and foremost in terms of the testing that's was problematic at first, but certainly has been improved. But then really the course of, how people are responding to the infection. Certainly this has impacted everybody, not only for individuals, but also for my patients, geriatric patients in long-term care facilities that have been impacted tremendously. So when a referral comes in specifically for COVID-19, getting the background information, and then initially I was able to go every time a consult came in to the hospital to lay eyes and speak with the clinical team. Unfortunately, what's transpired is that there has been a general lockdown. So when I had access previously, I do not have access now. So everything is dependent upon communications remotely. In some cases, those communications have occurred without much delay. In others, it's been problematic. But the team at DDS has been working around the clock to make sure that we're on top of what's going on, and more importantly, how individuals are responding while they're hospitalized, but for those who are recovering, their entry back home or to any of the providers. I would say there's been a lot of complexity. The COVID-19 pandemic has certainly begged some questions, about where do we go from here. We are continuing to learn about this virus, and over time, I think we'll have better understanding of what course of action to take. But, for the, I would say that this infection, there's, for this population, they are fragile, and it has had its consequences. And then for those who are caring, I can't express enough for the providers who are then caring for, and the direct support staff, my sympathies to those, and it's all of us on the front line trying to manage this as best we can, when we can look in the general public at what the impact it's had. So my, not to go on and on, but my, which I have a tendency to do, but really it's trying to support in any way that I can. And then, everything is, working with each case individually. You can't say one case is going to be the same as the next, but there are some certain characteristics about this COVID-19 infection and some consistencies in the patterns. But we still have a lot more to learn.
Thank you so much, Dr. Brown. We have question about the retainer rate.
Oh, before we get there, are there any questions for Dr. Brown?
Are there specific questions regarding Dr. Brown? Or for Dr. Brown, I'm sorry, not regarding, but for.
Okay, Crystal, would you continue?
All right. Has the retainer rate for day programs been finalized?
Yes.
Can you provide clarification on what is needed in order to amend the ISP to approve providing affiliated services remotely, excluding PT, which has been discussed earlier? We are getting conflicting information on what we need to do in addition to getting approval of the team.
So this question is a recurring question, and I believe I also received an email from the provider on this. And sort of generally, the request was all services should be able to be provided remotely. And I've said time and again that I'm not willing to take that position without ensuring that the team has looked at the individual. People have complex clinical needs, and because of those complex clinical needs, the individual case would need to be considered. The person would need to be willing to receive the services remotely and able to receive the services remotely, as well as the team and or guardian supporting the person agrees with that. So I'd take a call at 202-730 to talk about it again. I'll take that call.
How many cases have Dr. Brown been involved with of people who are hospitalized?
The question is directed at Dr. Brown, but as I stated before, I don't see that question really being specifically beneficial to this group, and I will take a phone call or a direct request for that information.
Are there any other questions? Please type that into the chat box and we'll hold.
Seems as though we don't have any more questions. I'd just like to once again express our deepest appreciation for our provider community, our community-based advocacy groups, our self-advocates, Project Action Yay, great call last week, our external stakeholders, our partners with DHCF, DC Health, the Department of Behavioral Health, and other DC-based groups. Also, like to special shout out to the DDS staff who's been working in this environment, this changed environment, and just everyone stay safe. Take care of your heart, your head, and your mind. I'm sorry, I was trying to be prophetic. Take care of your heart, your spirit, and your mind. Drink plenty of water, wash your hands, social distance, and enjoy life as best you can. Oh, yeah, and wear your face coverings in public.
And we'll see you next week at 12 p.m. Thank you. Take care.
Bye.